10% of other organisms with mostly anaerobic bacteria, but also a small amount of aerobic bacteria and yeast, as you know, because yeast infection is one of the more frequent vaginal infection. Next slide. The best way, or one of the best way to diagnose a clinical infection is the symptomatic approach. But the symptomatic approach must be very careful. First of all, in case of vulvovaginitis, we could relate these symptoms to candidiasis. In case of unpleasant smell, we can relate this symptom to bacterial vaginosis. And in case of yellow fluid leukorrhea, we can relate this symptom to aerobic vaginitis. But as I told you, we must be very careful with this symptomatic approach because we have a lot of misdiagnosis, especially with candidiasis. Yes, pruritus is mostly due to candidiasis, but sometimes with bacterial vaginosis or with aerobic vaginitis, we can find a slight pruritus. So it's a reason why it's very important to have a clinical examination. It's evident, but I think it's important to precise for candidiasis. First of all, the type of erythema in candidiasis is very specific because this erythema involves either skin and vestibule. It's not the case with dermatologic problem, which involves only the skin area. This erythema in case of candidiasis is irregular with irregular limits, just not the case for psoriasis, for example. And candidiasis is associated with the thick, white, curd-like vaginal discharge. And in case of dermatologic problem, it's very rare to have this type of discharge. The most frequent differential diagnosis is psoriasis. On this slide, you can see on the right candidiasis with the poorly demarcated erythema, as you can see, and we can see the discharge coming from the vestibular area. On the left slide, you can see psoriasis, and you see immediately the difference of the type of erythema with the well-demarcated lesion which involves the pubic area, which is not the case of candidiasis. That's only with the clinical examination we can have an idea of the difference between candidiasis and psoriasis. Concerning the treatment of candidiasis, we know that we have to associate vaginal tablet and cream with antifungal product to decrease quickly the inflammatory syndrome, because inflammatory syndrome is essentially outside, and the cream is very essential to reduce quickly the inflammatory syndrome. And the other point is if you prescribe an antifungal cream, you will reduce the risk of recurrence, because you know candidiasis, genital candidiasis, is the only vaginal infection which involves internal infection and external infection. If you cure only the vagina, you have a risk of recurrence because you keep some candida outside, and it is the reason why it's very important to associate cream and vaginal tablet as well. In case of recurrences, the best treatment, the most frequently recommended treatment in case of Candida albicans, because this product is not efficient on other type of Candida, is fluconazole with 150 milligrams per week orally for 3 to 6 months. And as I told you, Candida non-albicans are generally resistant to this product. In this type of recurrence of candidiasis, it's very important to associate probiotics. We will take say a word about this type of treatment, but it's with all type of vaginal infection which can recurrent. It's important to associate probiotics. And another very important point is that as candidiasis is a vulvovaginal infection, and as candida develop in acidic environment, it is very important to prescribe or to counsel a slightly alkaline product for hygiene, which reduces the risk of growth of candida outside. This is the reason why a product like Saforel is well indicated in this case of vaginal infection, but as we are going to see, we can use Saforel daily as well. But in candidiasis, it's very important to prescribe this type of intimate hygiene product to reduce the risk of recurrence. Bacterial vaginosis is probably the most frequent infection, genital infection, but it is not. It's not well known, and it's more difficult for women to talk about that, because they dare to talk about this main symptom, which is a very bad odor coming from the vagina. It's rather easy for a woman to say that she has pruritus or burning in the vaginal area. It's rather difficult to say to the pharmacist or to the gynecologist that she smells very bad from the vagina. It is the most frequent female infection, 30 to 35% of all vaginal infection, and this is the prototype of the vaginal dysbiosis. It is due to an imbalance of the vaginal microbiota with depletion of lactobacilli, sometimes with the complete disappearance of lactobacilli and replacement by commensal bacteria, mostly anaerobic, like Gardnerella vaginalis, Atopobium vaginae, Prevotella bacteria, and so on. And mycoplasma as well. You know that the two types of mycoplasma which can find inside the vagina, like ureaplasma hereticum or mycoplasma hominis, can grow in case of vaginal bacterial vaginosis. It's not very severe infection, but in one case during pregnancy, this infection can induce a preterm birth, and it's very important to precise this type of infection or to diagnose this type of infection at the very beginning of the pregnancy, because if the treatment is not done very quickly at the beginning of the pregnancy, we increase the risk of preterm birth. I like very much this slide. What are the symptoms of this bacterial vaginosis, which I remind it's the most frequent infection? It's based on a clinical diagnosis with three main criteria. First, it's fluid discharge. It's very different from candidiasis, as you can imagine. Very bad smell. It's a fishy odor, and this odor is due to Gardnerella vaginalis or Atopobium vaginae, which produces aromatic amines which are named cadaverine and putrescine, and you see exactly the type of odor this vagina smell. And this is important because these patients are ashamed of this odor, as this odor grows and grows after sexual intercourses, because cadaverine and putrescine is at a very high level when the pH is important, with the great pH. And as the sperm is at 7 to 8 in pH, we increase the risk of unpleasant smell, and after sexual intercourse, it's terrible. It's an error. So these patients are ashamed to talk about that, and they avoid sexual intercourse and so on. And some of my patients told me that I know when I went out from a bureau, everybody is opening the windows, but it's not true. It's not as dramatic like this, but they have this odor in the nose, and it's important with the quality of life to diagnose and to treat this type of infection. The pH of the vagina is higher than normal. You know that the vaginal pH in healthy women is ranging from 3.5 to 4.5, and in case of bacterial vaginosis, it's higher than 4.5. It reaches more than 5 in most cases. These criteria are very indicated for the diagnosis with a good sensitivity and a good specificity, as you can see on this slide. As I told you, bacterial vaginosis is a prototype of the imbalance of the vaginal microbiota. But what are the causes of this dysbiosis? First of all, a lot of antibiotics can alter the lactobacilli strains. Antibiotics like tetracycline, beta-lactamine, or quinolones, which are very frequently involved in bacterial vaginosis. The use of antiseptics for the intimate toilet, but we are going to talk about that in a few minutes. Hormonal modification, pregnancy, and especially in postpartum, because we have a dramatic decrease of the level of estrogens after birth, and this decrease of estrogen leads to a lack of lactobacilli and a risk of bacterial vaginosis. After menopause, it's the same thing, because there is an important decrease of the levels of estrogens. Some contraceptive pills with a very low dosage of estrogens are sometimes involved in the bacterial vaginosis. It's the reason why in some cases we have to change the contraceptive pill. And IUD, intrauterine devices, but it's not clear. I think that hormonal IUD are less involved than copper IUD, but it needs some further evaluation. One very important cause of dysbiosis is unsuitable intimate hygiene, like douching, and we are going to talk about that in a few minutes. Sexual activity, we know that homosexual female, women who have sex with women are high risk of bacterial vaginosis, probably because they have an exchange of vaginal fluid from one woman to another, and it's probably the only case where we can involve sexually transmitted possibility for this infection. Stress, important cause of dysbiosis, and tobacco, very important, because tobacco use induce decreasing level of estrogen in the blood and in the vagina as well. And when we have less estrogen, we have less glycogen, and nitrogen is the main nutriment for lactobacilli. So women who smoke have high level, less level of estrogen in the vagina and less lactobacilli. The treatment of bacterial vaginosis, we can use antibiotics like secnidazole, which is a one-dose treatment, 2 grams orally for 1 day, or metronidazole orally. The vaginal tablet of metronidazole are not efficient on that, so we must use metronidazole peros, but it's a 7-day treatment. It's less common than secnidazole treatment. Probiotics are recommended since the first episode of BV, because, as I told you, BV is a prototype of the dysbiosis, of the vaginal imbalance. So the point, we have to prescribe probiotics at the very first episode of this infection, and after with recurrence as well. Just 2 or 3 words about the role of probiotics, of vaginal probiotics. As you can see in this slide, we have a lot of strains of lactobacilli which can be identified from the vagina area, but we have only 2 or 3 very frequent strains inside the vagina. On the first column, on the left, you can see that Lactobacillus crispatus can be identified in almost 50% of healthy vagina, but no Lactobacillus crispatus in the bacterial vaginosis on the right column. On the other hand, you can see with Lactobacillus iners, which is the fourth Lactobacillus, we can find this Lactobacillus in safe patient, but we can find it in the bacterial vaginosis as well. This is a false friend. This lactobacilli can have very negative effect. So we have to choose very carefully the strains of lactobacilli, because some lactobacilli are very efficient, other lactobacilli are not efficient and can be harmful. This is the reason why we must choose the strain of lactobacilli for the probiotics very carefully. And Lactobacillus crispatus is one of the most important strains because he produces hydrogen peroxide of hydrogen, and this component is very important because it has a very harmful effect against other bacteria, endogen or exogen, like gonorrhea, like chlamydial infection, even against HIV. It produces antibiotic-like products. It's named bacteriocin. It has an antibacterial activity against Gardnerella vaginalis. It inhibits the growth of colibacille, of Escherichia coli, which is the main strain involved in urinary tract infections, and antifungal activity against Candida albicans and no Candida albicans. It is important in some part of the world, because in France yeast infections are due in 90% to Candida albicans, but in some part of Asia I know that non-albicans Candida are very frequently identified. So Lactobacillus crispatus have a very good effect even in non-albicans Candida. The important points that Lactobacillus crispatus can create a biofilm. Biofilm is something, a sort of wallpaper on the vaginal wall, which protect against the invasion of aggressive bacteria. And this is an important property of Lactobacillus crispatus. It's a marker of a healthy vagina. It is a reason why it's a very good strain for probiotics. We evaluate the efficacy of this strain in a French clinical study concerning women with recurrent bacterial vaginosis, and it was a study conducted versus placebo. And after the treatment, we found that twice fewer patients with at least one confirmed clinical recurrence in the crispatus group versus the placebo group after a 4-course treatment. That means that with this type of treatment, we stop the recurrences in 50% of cases, which is very important. And icing on the cake, when we observed recurrences, the first recurrence was longer of 20-80% with Lactobacillus crispatus. So this is the clinical proof that these probiotics can be used to prevent recurrence of bacterial vaginosis. We have other studies, but we have no time to discuss about that today, on candidiasis and so on, but for bacterial vaginosis we have the proof that this probiotic is efficient. Now we are going to see how intimate hygiene intervenes in the management of genital infections. I'm often told, for centuries, women have used traditional products even to wash inside the vagina, and they never complain. So what is the problem with the intimate hygiene? My first answer is it is not because women never complained that they didn't suffer or they didn't feel uncomfortable in the vaginal area. Because the world has absolutely changed, and it is not a marketing problem, it is a real necessity. So the first step is to avoid this type of instrument, which are very barbar instruments, and I like this one very in the bottom of the slide, which is Alibaba. I don't know what type of cavern she is going to wash, but it seemed very pleasant for me. You see that in the 50s, Coca-Cola has been recommended to wash inside the vagina. I don't know why. And in France, we have a magic potion coming from druids, and you know these products are not very efficient and are very harmful. So, way to speak about intimate hygiene, as I told you, the world has changed. The world has changed, and 15 years ago the problem was absolutely different. Clothing habits have changed, food habits have changed, the society changed, and the work of women changed. From now we have a lot of sedentary works for women. The means of communication changed, and now on the web every woman can find some discussion with other women who have the same problem. 50 years ago it was not possible, so it's a reason why a lot of women didn't complain of any problems, because they were absolutely, they think that they thought that they were alone in the world. They are not alone in the world. The access to sexuality changed, and at this time, women claim rightly the right for genital comfort as well. So the question we are going to discuss is, have we to counsel patients about intimate hygiene? Why not a toilet with water? Why not a classical soap? What are the best products of intimate hygiene? First of all, why you have to discuss about these products? Because some hygiene habits are harmful. Just one example, vaginal douching can promote the imbalance of the vaginal microbiota and produce bacterial vaginosis, sometimes aerobic vaginitis, and sexually enhance the risk to acquire or to develop sexually transmitted infection and HIV infections, and enhance the risk of preterm deliveries. So we have to talk about, it is our real part of our job to talk and to detect what can be the harmful habits of our patients. Second, why not only a toilet with plain water? Because as I told to my patient, when you're washing your hands with water, do you feel clean? No. At the evidence, no, because water is not sufficient to eliminate the cellular or bacterial debris, and because frequent contact with water, that's a dermatologic investigation, because frequent contact with water can change local hydration, which is very important in the vulva area. So cutaneous hydration doesn't come from the outside, but from the inside. And to protect the evaporation, the deperdition of water, we have an hydrolipidic film at the surface of our skin to reduce the evaporation of the water. And when you wash very frequently with water, you destroy this hydrolipidic film. So water can worsen dryness of the vulvar area. And we know that the pH of current water is more than 8, and it is not indicated for the skin area. So, as I told you, the extended exposure to water destroys the natural moisturizing factor, and it enhances the risk of dehydration. So, no toilet with plain water. Why not use a classical soap? Classical soaps like Savon de Marseille in France, but in other parts of the world it can be Savon d'Alep or something like this, are made with animal and vegetable fats. They have a drying effect, especially in cutaneous areas needing an important moisturizer like vulva area. And the excessive use of this soap have exactly the same effects than water, than in description with hydrolipidic film, with the inappropriate pH. Sometimes these products are at a pH with 10, which is absolutely not indicated for this area. So the response is no, we haven't to prescribe this type of toilet. Last, what are the best products of intimate hygiene? Vulvar hygiene must respect the local moisturizing hydrolipidic film, as I told you a few minutes ago, local microbiota and local pH. The respect of natural moisturizing, we must respect the hydrolipidic film, which is a natural barrier against the microbial damaging and the elimination of wastes. And it is not important during sexual intercourse, because some patients complain of dryness during sexual intercourse, but they can feel dryness daily from the beginning of the day to the end of the day. And it is important to ask these women, do you feel uncomfortable during sexual intercourse, but do you feel outside of this sexual intercourse, do you feel well or do you feel dry? That's important to precise this type of dryness. As I told you, plain water and classical soap can damage this protective film, and synthetic detergents like this one are more respectful to epidermis and better protection of the hydrolipidic film. So they are suitable for the intimate hygiene. The respect of local microbiota is very important. You know, the microbiota of the vulvar area is very complex. On the external side of labia major, you have a microbiota which is a cutaneous microbiota with streptococcus, staphylococcus, and so on. In the vestibular area, you have absolutely the same type of microbiota that inside the vagina, and with lactobacilli. And what is important to understand, then, the natural reservoir of lactobacilli, of vaginal lactobacilli, is a rectum. When you have a lack of lactobacilli inside the vagina, you can have transmission from the rectum to the vagina to fill the vagina with the new lactobacilli. And this progression will take place within the perineum area. That's the reason why if women use chemical detergent antiseptics, they kill their lactobacilli. And a lot of women who are using this type of detergent, of antiseptics, use it because they feel uncomfortable or they have infection. And they thought that if I use antiseptic, I will kill the bacteria. Yes, you are going to kill the bacteria, but not especially the bad bacteria, but the good bacteria as well. So it's important to counsel not using antiseptic, chemical antiseptic for the toilet, because it worsens the case of infection. No antiseptic for genital hygiene. But how can we explain that the product of intimate hygiene prevent from infection? First, by respect of the vulvar specificity, as I told you a few minutes, prevention of chemical or physical damage, and respect of the vulvar microbiota. And one point important is the respect of the local pH. You know, it's the most frequent selling point of hygienic products, but a lot of companies say, my product respects the vaginal pH. It is a false idea, because we have nothing to put inside the vagina. So the intimate product is only for washing the external area. And what is a good pH of the external area? It's come from 4.8 to 8 in the external area in the skin. So there is not one good pH. There is only a range of good pH from 4.8 to 8. And there is not only a good pH for the genital toilet products. To prove that, IPRAD made a clinical study some years ago comparing in women using for 2 months either acidic product which is named lactacine or a lightly alkaline product which is in the vaginal area or in the vulva area. One point is only when you have candidiasis, which is an indication to use an alkaline product, as I told you at the beginning of this presentation. So to conclude, the specification of a good product of intimate hygiene must have a pH ranging from 4.5 to 8, respect the physiological moisturizing of the vulva, respect the local microbiota and avoid absolutely antiseptics, and participate in improvement of clinical symptoms in case of local irritation on dryness or dryness. This is the reason why in Saforel you have a component which is burdock, like this, which I knew the name in French, but in English, burdock, yes, burdock, which is very important against dryness. It's a throat dryness, not vaginal dryness. No burdock inside the water, but it's better. Okay, so other advices: excessive hygiene is as harmful as poor hygiene. The obsession of cleanliness and smelling sweet actually can be very unhealthy. Unsuitable hygiene products can give rise to irritations, dermatologic disorders, or even enhance infections. Genital hygiene, as I told you, is a fully medical action because it will protect against the use of unsuitable products. You can find in ads, friend and mother advices, which are not even good. And the use of specific products can provide a daily comfort, limit the risk of genital troubles, and contribute alone or associated to specific therapy to the improvement of vulvar symptoms. For all these reasons, physicians and especially gynecologists are in the front line for this counsel. Hygienic recommendation must become automatic, the very first consultation, even with very young patients, and as well as other prescription, even in healthy women. And I think it's important to have a glance, to put a glance to male intimate hygiene, but is another debate we will have further. Thank you for attention.